I'd like to start off by sharing with you a case that came through my practice, and it was a case in a patient who was a low risk, but in spite of her being low risk and a mammogram that was relatively easy to interpret, the usage of AI was really highlighted here. So here I have projected for you CC and MLO views in this patient who has pretty fatty, breast tissue. And I have her current mammogram on the bottom. Her prior mammogram from 19 months ago is on the top. And as you can see here, if I can show you the next slide, we can go in on the close-up images. We can see here that there is a small focal asymmetry in the retroareolar right breast. Now, of course, hindsight being 2020, we see the focal asymmetry on the current views. When we look back at the priors, it was there, but it wasn't picked up at the time. However, when we use the tool with iCAD, if you could show the next slide with the images, had this tool been implemented 19 months ago, it had picked it up even back then. And what we can see here is the color actually gives you, more of a risk probability in the sense that if it's red, it would be a higher risk lesion versus a yellow, which would be moderate, and green, which is essentially nothing, but it's probably benign. So when we look at the red and the yellow, it was there and it had a high K-score, which is a probability score essentially for how likely this lesion is going to be malignant. And if you could show the next slide. Again, we see the same thing. Had it been picked up, had the tool been used 19 months prior, we could have seen this even back then. If you could go to the next slide, please. Thank you. And here I can show you the scorecard, which not only gives you the lesion with the highest K-score, it also provides you with a breast density. And also overall, looking at the whole mammogram, it provides you with the patient's risk of developing breast cancer over the next 1 to 2 years. On the scorecard from 19 months ago, this patient had a 99% K-score, which was due to the lesion that was identified in the retroareolar right breast. And at that time, her risk assessment was moderate. On her current mammogram, we see that same lesion exists. That same lesion has the same high K-score, and it also has the risk of developing breast cancer over the next 1 to 2 years as being high.